right, guys. What's up, man? What's up, everybody? I'm gonna bring Daniel on right now because my internet is funky. Um, and we're just gonna get straight into it. Daniel, thank you for joining us tonight. I apologize for the delay. I was having some problems with the internet again. I don't know what it is. It's starting to be very irritating. But anyway, I know we have we don't have everybody on right now because everybody's been waiting. I just wanted to say I'm sorry. Charlie's out tonight. But like I said, we do have Mr. Daniel Ross from the Hawaii Nurses Association. A lot of things to talk about, Daniel. Um, you know, we've been talking a lot lately about our healthcare workers, about our school teachers. But I think, we've been watching you on the news and we've been hearing your message. And I kind of wanted to share the last time you came on our show, believe it or not, the video, the whole video got deleted. It got taken out from Facebook. Someone had made a complaint that we were spamming people. I don't know how you spam somebody that you're broadcasting to a personal page. I've always said if you don't like watch, no watch. So because of that last incident with your show and your message, which we thought was fabulous, we now broadcast live on YouTube, Twitter, and LinkedIn. So if just so happen someone decides re- to delete our video, we will still have it on YouTube, LinkedIn, and Twitter. So with that, Daniel, again, thank you, thank you, thank you. No, I know, Pops. Everybody thought I was off. I just could not get my doggone thing connected. So we're connected. I'm going to turn it over, Mr. Ross. The floor is yours, man. I think let's just focus on what the hell is going on. We are being told that everything is okay. We're under control. I have a lot of friends and family in healthcare, not just here, but on Oahu, and it's not okay according to them. So give us the real scoop, the what's really happening here in Hawaii.
Well, thanks for the platform. We appreciate being able to give you our perspective. It, it's bad right now for the healthcare workers. So this surge is very different than the last one, right? So the majority of people who are being admitted with COVID are not so sick as last time. Those patients were it was the ICU beds that we were running out of. Now it's the med surge and telemetry beds. And it's not necessarily the beds, it's the workers. We do not have the workers because we have multiple. So in Queens alone right now, the report I got as of this morning, there were 944 employees out. 944. That's not only nurses, but that's all employees. Of that, there's 200 or 300 of those are nurses. And they're out because either they have COVID or their spouse has COVID and they can't isolate from them, that sort of thing, which is where the CDC has loosened up their rules about people coming in or returning to work. And our hospitals here have loosened the rules some, but not. They're still, if you have symptoms and positive, you don't come to work. What they've reduced is the quarantine time after you're being exposed. As long as you test negative, you can come back to work sooner. So what's happening is we're just extremely short-staffed. We just do not have the nurses to care for the people. So at Queens right now, there's some close to 50 beds that are closed because they don't have nurses for them. So 20 out at Punch Bowl and 25 out at West Campus. And it's just because you don't have the staff. The last few times I've been working, we've been working short. We get by. It's not like the worst that I've experienced, but it's definitely very concerning. And more people. So the hospitals, most of the large hospitals are offering incentives for people to work extra shifts. The places like the SNF facilities, it's the nursing homes, they're even in worse shape because they can't afford to offer much in the way of incentives. And those nurses don't make as much, and they are mandating overtime right and left. My wife works in an SNF facility, and she gets back-to-back double shifts, 16 hours, come home for 8, 16 hours again the next night. She's even gone where she's worked, come home for like 8 hours and gone back for another 8-hour shift or 10-hour shift. And it's commonplace. So right now, it was in the news that, they got 100 and something female nurses. Well, no, they were supposed to get 113 female nurses, but only 96 showed up, which is what happened last time too. They book and there's people that don't show up. And of those nurses, not all female. They all came to Queens this round, and 74 of them are female, and 22 are agency nurses that Queens directly contracted with. There's supposed to be more coming in on the 24th and again on the 31st. And there's also respiratory therapists included in those numbers. So that will help tremendously, but the numbers are just astronomical. And so we're looking at them continuing to grow. We're not seeing the healthcare workers are a reflection of the community we live in, right? So as those numbers are so high in the community who are testing positive, well, it's reflected in the number of healthcare workers that are testing positive and needing to quarantine. So hopefully these will take some of the burden off of us and give us some rest. Because honestly, this has been going on for 2 years. It gets worse, gets better, gets worse, gets better. But it's been going on for almost 2 years now. And we're exhausted. I think I speak for just about every single healthcare worker out there. We're just exhausted. It's one thing after another. And people are going to quit. People have quit. They've retired. It crosses my mind all the time. I'm burnt out personally. And it's like, how much can I go on? Just last week, I was at the verge of resigning just because the pressures were just too much. I took a little bit of time for myself, and I was able to come back. But it's a pervasive problem, and I don't know what the right answers are for it. It's concerning. You see a lot of people. It's like they're not shutting nothing down, right? So I don't know. It is true. They're not. It's not a lie that people aren't as, in general, as sick. There are still some individuals who get very, very sick and are dying from it, right? But it's fewer in numbers. It just looks very different. But the nurses who are my unit, I'm not even taking care of COVID patients myself right now. Our unit, we were slated to go COVID, and then they changed it around and they're going to put the COVID patients in the semi-private rooms, double up 2 COVID patients in a room. The unit I work on is all private rooms, which last time we did all private rooms, or mostly all private rooms. So they're looking at just bed capacity because they're expecting the numbers to continue to grow. Right now, Queens has about 130 or so COVID patients, 105 of those at Punch Bowl, 22 at West. I'm not sure how many North Hawaii has, but the ICUs have not lots of space, but they have space. They're not full of COVID patients. There's a few COVID patients there, but the ICUs are not full. It's the med surg floors and the tele floors, and the workload is so much more because most of these patients in there. It was just another thing that some of the conspiracy theorists are going. Theorists go, so these people are in the hospital for another reason, not COVID, and that's not a lie. That's true for a large part, not exclusively, but for a large part. But that just means they're that much more work and that much harder to take care of because you're treating that other problem, heart disease, wounds, whatever it happens to be, plus COVID, plus you're doing all that isolation. So it's that much more work and that much more exhausting. It's I know we talked about it before. People are like, well, what's the big deal about putting a gown? It takes a lot of time, especially when all of your patients, you have to take it on, put it on and take it off, put it on and take it off. It just is time consuming, and you only have so much time with your patients. So I don't know. We're struggling. We're having a hard time. We need more nurses. This is the song that we've been singing for multiple years before the COVID pandemic hit. We've been saying that all the facilities need to hire up, not just the acute care hospitals, but the long-term care facilities, the SNFs also. They need to incentivize to recruit and retain nurses. We're competing with the mainland to keep qualified people here. The nurses that are working in Hawaii are working in Hawaii because it's our home, and because we can go anywhere in the country and have a higher standard of living because it's so expensive here. I could have a big house with a pool working as a nurse, really nice in the mainland someplace, instead of just getting by in Hawaii. So in order to compete, they need to step it up because we need to bring in more nurses here. They're training more, right? They keep talking about, and that's been the government's response is, nursing schools. Well, traditionally the hospitals haven't been hiring the new grads. We're getting Queens, because we pushed on them big in the last contract negotiation, is doing more on the new graduate nurses, but it's still not enough. But we can't have only new graduate nurses. We need more experienced nurses also. So it's the hospitals, and it's on the big facilities like Queens and Hawaii Pacific Health to hire the new grads, because the little ones can't absorb it. It's the big places that need to do it and give them experience, so our local nurses can have the jobs here and care for the people of Hawaii, and we have enough staff. And it's kind of in a nutshell, the situation where we're at now. I don't see an end in sight. I don't see it getting better anytime soon. Right. So I don't know. Do you have anything in particular you want me to talk on, Mel? I don't see you. We lost Mel. It says everyone can see and hear me. So I don't know if anyone, is there a chat? Can bring in any questions. I'd be happy to answer. Like I said, so we're pushing now. We're going to have a bill introduced. We've got senator and representative who are going to introduce on both sides to ban mandatory overtime, not banning overtime, but mandatory overtime for nurses. And that's going to force the facilities to hire people up, because some of the smaller facilities, instead of hiring nurses, they rely on mandating people to work overtime. So that is going to be a big in our future, and we hope that that'll be successful. We've been trying to collaborating with a lot of other organizations, nursing organizations, Filipino Nurse Association, the American Nurses Association, their Hawaii branch are collaborating with us. The Center for Nurses collaborated on this bill. And we hope we won't get too much opposition from the employers. We know there'll be some, because they want to be able to mandate. And we're not saying no overtime. We're saying no mandatory overtime, because the nurses themselves, or whoever the worker is, they're the ones who can judge what is their safe limit of working overtime, not the employer saying you have to come in, back-to-back 16-hour shifts. It's just not safe. We have places where they're mandating nurses to work 20-hour shifts here in Hawaii. 20 hours. Do you imagine being responsible for somebody's life, quit for 20 hours working? It's just not a safe situation. So lots going on with that. The hospitals, the Kaiser, Queens, and HPH have started offering incentives to have for nurses, so they'll give them a little extra money for picking up extra shifts beyond what they're normally scheduled for, which we encourage. It's giving you an incentive to do it rather than forcing you to do it, and when if it's the person's able to judge for themselves what they can do. So I don't know. So I don't know if anybody's even hearing me at this point, because I know Mel was having issues with the internet. It says everyone can hear me. but I'm not getting any feedback. So, okay. I kind of just blew through everything in about 10 minutes there. A little different, trying to do it as a monologue. So I'm not sure what else, if there's a way for you guys to send me anything in this chat. It still says everyone can see and hear me, but I'm not seeing or hearing anybody else. So, oh, where'd you go? There we go. They can hear and see me. I'm just not able to connect. Okay, so Mel's out. But yeah, guys, sorry. I was kind of expecting to be answering questions. So that, I gave you the rundown of where it's at. I know that, to say again, the nurses are exhausted. We've been going on for a long time with this and with these shifts. The other big issue that we've got is workplace violence. So, we had a news press release on that a while back. The hospitals did a little bit on it, but it's been going on for a long time, where traditionally the hospitals just kind of brush it under the carpet, and even the police discourage charges being pressed and that. But it's now we're getting stuff related to COVID. We've had people in the COVID units, family get in there who, they believe these conspiracy theories, and they say that the medical workers are killing their loved one, and they've threatened to come back and shoot them. They've come in there and gotten violent, and we've had to call HPD, and that's a real big concern. And it all kind of, the thing that we're pushing on with management on it is they're like, oh no, we're trying to protect, but how do they get in? The hospital's supposed to be secure. It's not that secure that these people who came in without a mask, who were yelling that they have COVID, were threatening violence. I'm not sure if in that case, I don't believe they actually struck anybody, but we have had other instances not related to COVID where it's commonplace. You're more likely as a healthcare worker to be assaulted than you are as a prison guard. We're the highest assaulted professions out there. And what we're pushing on management to do is take a zero tolerance on that line. It's like press charges, set an example, ban them from the hospital, kick them out. If you don't believe that the hospital has your best interest and that they're working for you, don't come in. Nobody's forcing you to come into the hospital. We want to help you. We're there to help you. And it's that much more frustrating when you're trying to help people and you're being threatened for it and being accused of trying to kill them. So I'm not sure.
All right.
There he is.
Can you hear me now?
Yeah, I got you. Some technical challenges today.
I don't know what the heck. I'm on my phone, obviously. Thank God I could. I don't know what happened, and I can see you on my Facebook. So the stream didn't get cut. Just I got cut from my own stream.
Yeah, that's what I kind of thought was going on, but I wasn't sure. It said everybody could hear me, but it's not like I could see in a chat people saying anything. So I wasn't sure if I was just talking to myself. And I'm not used to just doing a monologue. I'm used to more of a dialogue.
I don't know what it is, man. It's every time you come on, we get issues. I don't know, man. I think somebody doesn't like us together.
I think you're right on that. I know in the previous one where we got that one was real suspicious, and it was definitely somebody connected who did not like the message that was being told.
Okay, hang on, I gotta just do one more thing here.
Sure.
Okay, can you hear me now?
Yep.
Okay, for some reason I hang on here. Anyway, I wanted to ask you. I just emailed it to you. This is so old. I'm doing it so old school, but we keep hearing that we're going to be peaking in a few days. I'm hearing from all the other experts across the country that have been saying, be careful. This is we're not heading to a peak. Can I turn my thing horizontal? Oh yeah, I guess I can.
There you go.
Anyway,
Uh,
what are your thoughts? I know it's probably out of your wheelhouse, but any thoughts from what you're seeing?
well, I think it's still climbing. We're still looking at it going up until so we're gonna know that we've peaked and it's starting to come down when we see the numbers in the community start to come down. When we're not getting the 4,000, 3,000, 4,000 positives a day, we'll see that reflection in the hospitals, right? Hopefully, we'll start to see more healthcare workers coming back to work, getting over it and being able to come back to work, and fewer patients in. And it's really, that's what with this one, with this particular surge, it's not just, the danger, and it wasn't to the previous one too, but even more so now, just because it's the overload of we did not have the number of healthcare workers out with the last one. We had some out, but not the same numbers. But now, so if you come in for any other reason, and a good majority of the people that are coming in with COVID are coming in for another reason too, or a good proportion anyway. It's that much more deadly. You're not going to get the same level of care. The hospitals don't want to say that. They want to say, "Oh no, come," right? So Queens is operating in a disaster mode right now. So they declared a disaster at the West Campus, and the next day they declared a disaster at the Punch Bowl campus, and that allowed them to do a few things. We have a little bit of abbreviated charting, take some of the tasks off, and a few other things. And I think it was also to help spur getting some help out here with FEMA, which is coming, and we're looking grateful for that. But I don't see an end in sight. I don't see the numbers coming down yet. So when you see the numbers coming down in the community, I think that's when you'll see that, we must have hit the peak, and a few days later or a week or so later, we'll start to see it starting to drop in a hospital. It's still growing. It's not going down yet. So I don't know what it's going to be. I hope they're right in to say that it's peaking. I don't know
It's
that for
kind
a
of
fact.
it's kind of hard because when you think about, and the lieutenant governor said this morning on the spotlight, that, and many of the experts say the R naught is at 10, right? So every infected person is infecting 10 others. So when you have this many people running around infected with COVID, whether it's Omicron or remnants of Delta, it really doesn't matter, because even though the severity of the illness may be less in some people,
Mm-hmm.
as all of the experts have said, this is still a very deadly disease.
Mm-hmm.
And if, I think cutting back the quarantine from 10 days to 5 days, I think you're increasing spread, because you're allowing, and I'm not a doctor, I'm not a nurse, you're probably a better person to speak on this, but just based on what I know, you're allowing people to go out into the community, to the workplace, into the public, possibly still infected and contagious. So,
Yes.
and that's why
Yeah,
I think the numbers aren't going to go down, not for a while.
I think you're right, and when the CDC came out with the revised guidelines, you saw how it was just ridiculed across the board. It's like every expert and many lay people were like, "This is ridiculous." I'm sure you probably saw on Twitter that's a lot of the memes going around. The CDC now says it's okay to do this and that sort of thing, and you're right. We don't know, and you are going to spread it more, and that was the concern before in the early days when we weren't letting anyone test. We're afraid maybe you're an asymptomatic carrier, right? Now at least they're testing people, but testing if you're positive, according to the CDC, you can come back to work. But as far as I know, none of the facilities that we represent, at least, are having you come back to work when you're tested positive. until you go through the course, and they do decrease the time though. But what they have done is before you had a longer quarantine just when you were exposed. So if you had close quarters exposure to somebody, and now they're saying if you test negative after the exposure, the tests are coming back like the next day or within 12 hours now. Especially for healthcare workers, they prioritize them. We get the test backs pretty quick. If you test negative and you're asymptomatic, they're bringing you back sooner. And the caveat is, but you have to wear an N95 the whole time. And I've asked them, I haven't got the answer. So where do they get the N95? You have to walk all the way through the hospital and ride in the elevator to get to your unit to get your N95. I don't see them posting outside where you can grab them, right? So, because personally, since they have, in the early days, we couldn't get N95s, and it was a big fight just to be able to use an N95. But those J's have changed. At Queens, especially, they did a whole 180 on that. And if you want an N95, you can get one. So every time I do patient care, I wear a N95. I don't care if it's a COVID patient or not. If I'm taking care of patients, I'm wearing an N95. And I wear a KN95 on my way into work, because we have those. We can buy those in the public. The union has them. We give them to our members. And I wear one on my way into work. I get to work, I switch it out for an N95 because it's a better seal. So yeah, I don't see it peaking. The big thing about these reduced quarantine times, they're not based on science. They're not because we found out new science, right? It's based on need. It's based on staffing problems. That's what it's not saying, we found out that it's safe to come back to work sooner. No. So they found out that, no, we don't have enough workers, so you're going to come back sooner. So that's very, very concerning. And I get it. It's kind of a catch-22. What do you do, right? What do you do? You don't have the people. To me, our government is so wishy-washy, and it's gone, our state government, where things just keep opening up more and more. I understand it's tough. I've been living in this community for this pandemic for the last 2 years in this community, and nobody wants to lock down everything. I don't know where you draw the line. I don't have a magic book of answers.
Yeah, and I think it's the lack of any action. As it's so bizarre that as the pandemic started to surge again, we started to reduce restrictions. It's kind of backwards. We know
Yes.
the decrease in the quarantine time was based off of the crippling of the airline industry. We know this. This is not in dispute. Delta Airlines was one of many airlines that sent a letter to the CDC saying, hey, please, we cannot continue like this. We got to get our people back to work. And that was the start of it. And they somehow tried to justify it by saying this virus is not as, or infectious for not as long. Where the hell did that from? That's like you said, man, there's no science.
As far as I know, there's no science that says that.
There is absolutely no freaking science. I can tell you right now, I know of 2 cases that the infected person got tested positive after 5 days of the exposure. I know this for a fact. So whatever. They can say what they want. You know what is troubling, and I'm sure you've heard, I hope we're not doing this in Hawaii. I think you mentioned about it, that you folks are still doing the 5-day deal. But in some states like California, they're requiring their nurses to come back to work when they're still positive. But they said, we're only letting them work on positive COVID patients. So, I mean, that's crisis care. I understand that, but is that the way to do it? Or is a better way, or the better idea, to let's try to stop the spread and not deal with the spread? See, in our state, we deal with the spread. We welcome the spread, and then we'll just deal with it. And not everybody gonna die. Some might get really sick, but the vast majority gonna have little flu-like symptoms. And not once did I hear our lieutenant governor speak genuinely about the long haul symptoms and the long haul illness that this virus creates. That is also not in dispute. Zero opposition to that. The studies that say I mean, it's this. We have enough cases to show now that this is very common. That if you get COVID, there is a pretty good chance that you're going to have some long-lasting conditions, kidney, cardio. I mean, a lot, mobility issues. But they never talk about that. No, all they talk about is that we're heading to the end, and we just got to go get boosted. That's the whole message. And I'm concerned
And
that we're not being truthful with the people.
well, that was one of my concerns beginning. So, when the vaccines came out and they pushed on the vaccines so hard, and I support getting vaccinated, they're like, we got the vaccines, go get vaccinated. We're going to open stuff up. And they start opening up. And it's like, the vaccines are one of the tools. And we've seen with this latest variant that it's not as effective as it was with previous ones. So a lot of the patients that are in there are vaccinated. I still recommend that you get it. I recommend you get boosted. It's going to help, but it's less effective than it was under earlier variants. So just relying on that, and I think people are just exhausted, right? So they want to bury their heads in the sand and pretend it's not there, except when we have to go to work, we're reminded of it, right? Because it's so prevalent. And that's where the danger is. Yes, your neighbor like that, maybe one of them gets sick and ends up in the hospital, possibly dies or gets really sick for a long time, ends up as a long hauler. But in general, in public, people look okay. It's not like people are dropping dead all over the place, right? So it's easy for them to ignore it unless you're working in healthcare. And that is where you see its detriment, right? Because you're going to see that even people who don't have COVID are not going to get the level of care that they got before it because there are not the healthcare workers to watch them and to treat them. We just don't have it. You can only do so much. I've had, and that's where they call it. Not drawing a blank, but it's like burnout, but it's so you don't get old
That's not
words.
no.
It's like a moral crisis where you're because some of the last shifts I've worked, you come out of it and you're compromised because I didn't give the care I should have. Most of my patients got their medications late. I tried, but I couldn't get them. People didn't get their dressings changed because I didn't have time. I didn't get to it. I'd go from one thing to the next, So they're not getting the care they should be getting. They're not getting optimal care. And that's where you start getting bad effects. And, I'm not saying that anyone that I took care of got a bad effect because of that. Antibiotics a couple hours late, you can deal with it. But put that all together and you're going to have more deaths. There's statistics that show, I forget what the percentage is, but for every extra patient a nurse takes care of, the mortality rate increases. And so when you're dealing with that, and
every single nurse, every single aide, every single support staff that's in that hospital got to live with this every day. Like you just explained, that every day they go to work knowing that there's just physically impossible to manage these patients the way they should be. I know you made that statement. It was in the paper. I think I even saw it on the news in a clip. And I just wonder, are these nurses, and like yourself, and you don't have to answer if you want to, but are they getting counseling? Or, when the hurricane hit back in, what was that, 92? I was a cop and I got assigned to a lot of things, and we were definitely overworked. I mean, it was out of control. It was ridiculous and nonstop. And what we went through was nowhere near what your nurses go through, what your staff, your hospital, even the people working at the desk, the housekeepers, nowhere near what they go through every day. But even with our situation back then, the county or the department made us go see a psychiatrist after I forget how long already, but it was everybody had to go and
That's interesting.
had to see and speak to, because their PTSD. There was a lot of for that very same reason, because you were the staffing was reduced because you had officers that had lost their homes, and we didn't have enough cops, so people were working 20. I mean, it's just similar, but we weren't seeing death. We weren't seeing sick people. We saw a lot of people struggling, losing, personal effects, houses and stuff, and it was horrible, but nowhere near what you guys are going through. So I'm wondering, are our nurses and all of our hospital
You
healthcare
would
workers
think
getting
so,
some
right?
type of?
Because no, there's not. There is some out there, and it's interesting that you say that in the police that it was a required thing, because no, it is not. Now they do. So supposedly for Queens has a psychologist who there, and I keep hearing about it. I've never seen him. I don't know. Queens is a big place to have one person, and we have the same standard stuff that you always have, that most big companies have, EAP, and it's like I can self-disclose. I need to go to it myself. I've been meaning to, and I just am so busy I haven't gotten to it. I like a week or two ago, I myself was cracking. Like I said, I was on the verge of quitting.
Yeah. Yeah, and that's why I think, I don't think many nurses or healthcare workers are going to voluntarily go in, for a couple of reasons. Number one, a lot of them are just too busy, not even realizing that they're struggling mentally. I mean, besides the physical fatigue, and the other thing is they don't want to go to a doctor and the doctor says, "Hey, you got to take a
Moral
week or two
injury.
off."
That's the word I was thinking of, trying to think of.
What was that?
Moral injury.
Oh, yeah, more. Yeah. Yeah, so they're
Right.
not going to want to go to a shrink, and then the shrink says, "Hey, you got to take a week off," because what now, right? Your colleagues got to pick up the slack. So I can see why they would just go rough it, and I'm concerned about the health of our healthcare. I mean, I cannot imagine what it's like, and yeah, like you're saying, we don't have the deaths like we were having during the last surge, but people are sick.
Yeah.
People are sick, and we don't know what's going to happen to them, and we
Yeah, I
want to
mean,
be able to.
the biggest impact that we're facing right now with this surge is the shortage of staffing, and it's the same thing. It's like the airlines, right? And you mentioned that they pushed for these rules to change. They had to cancel flights because they didn't get it. Well, we can't cancel the hospital because we don't have staff, right? And the hospitals are, they're still doing elective surgeries. I'm like, why are you still doing elective surgeries? They stopped them before, but there's talk of doing it. I don't know. I guess they're not doing as many, but I took care of patients that are still having elective surgery, and I get it's a balance because you go so long, and elective, if you don't treat it, becomes non-elective, right? It's like things get worse. So it's such a balancing act, and I don't pretend to have all the answers. I say what I experience, and what the few things that we think can help. It's really frustrating, and I haven't heard about it. I guess it hasn't been in the news as much. Maybe they're not doing their demonstrations. The anti-vax and anti-mask people. That's so frustrating to deal with that, to see that. But we are getting, because like as I mentioned earlier, I know of firsthand of cases where family members or come in blaming the hospital staff that they're the ones killing their loved one when they've been working their butts off trying to save them. And it's just because they've listened to all of this, and they're in an emotional breakdown themselves, right? So I don't know where the right answer are. We need more staff. We need, our government hasn't taken this seriously enough from the beginning. So many, the hospitals back in early 2 years ago, they were so unprepared. I said, I sent all our major hospitals letters back in January before COVID really hit us. What are you doing to prepare? None of them were doing shit. None of them were doing a damn thing. And 3 months later, it was hitting. It was like, whoa, that's why I was asking, aren't you preparing? What are you doing? And if they don't have an answer for me, to me, that's an answer. That means you're not doing anything.
So, well, I mean, that's all the corporate CEOs from the hospitals are the advisors for the lieutenant governor. I mean, and the governor. That's what we see. We don't really see any frontline healthcare experts advising the governor. We see those guys that run hospitals, and it's those guys look at spreadsheets all day long. Their job is to keep the hospitals afloat.
Yep, that's they profess that it's all about helping people and that, but it's all about money.
Yeah,
it's all about money.
That's a sad reality, but that's what bothers me the most, is because I don't see this for myself, but I hear it. I hear what's going on in the hospitals from nurses and spouses of nurses that are just these nurses are just they're done. They're overworked. They're tired. They're overwhelmed. There's no end in sight. You send over a couple of hundred or 100 and few nurses. Now, Kauai won't get any of those. Those are probably all going to stay on Oahu. They said they're going to spread them amongst the islands, but where is the true need, right? Which hospitals are going to have first dibs on all these traveling nurses? And how many of these nurses are going to get test positive and get COVID or be exposed to COVID and be in quarantine? It's
there
like
will be some.
We short 900 nurses, and you trying to supplant that with 110 or 120.
Yeah.
I mean,
well, that's Queens alone. That short. Well, that's not just nurses, but workers in general, 900. And you're right. The bulk, because the population is on Oahu, the bulk are going to be on Oahu, are going to come to Oahu. I don't know for sure that Kauai has an earmark, but I know Big Island does from Queens, because North Hawaii is a Queens facility, and so I got reports on that. So they do have some going out to North Hawaii, and of the number of female nurses that come the last time around, and they think they'll get about the same. Queens system got about 1/3 of them, so they'll get the bulk. They got the bulk, and they think they'll get close to that this time, maybe a little bit less, because last time Queens really got hit hardest, and I think it's a little more spread out this time, where the other places are getting hit harder, because patients, the vast majority of patients, the sheer number, right, are not ICU. They're not. So you're the other facilities are. In the past, they would transfer them. They get really bad, they would transfer them to some place like Queens, right? So you're not seeing that as much with this. So it's getting spread out a little bit more even, I think. But and like I mentioned earlier, what never really gets talked about are the nursing homes. They got it much worse. They got it much worse than the acute care hospital. The acute care hospitals, that's more glamour, right? It's like it's better money. That's where the action is, like that. But in nursing homes, it's even worse on the staffing. I don't know. I don't know how my wife does it. The shifts that she's worked, it's insane. I don't know how she does it. I couldn't do it.
Yeah, I so appreciate you sharing that stuff. I did have one more question. I know it's 8:00, but how are the pediatric cases? We're led to believe that in Hawaii that we don't have any pediatric cases, maybe one or two, but yet across the country, the pediatric admissions have broken records constantly. In fact, at one point a couple of weeks ago, they said that there were more pediatric admissions to hospitals than adults because of COVID, not for non-COVID reasons. But you get any insight on that?
I heard that. I don't have any firsthand knowledge of that, and I'm not sure. I know there are some, but I personally don't work with pediatrics, so I would need to talk to my colleagues at Kapiolani. So our Vice President Rose is from Kapiolani, and she could give us some insight on that. But I know she's doing it. She we were talking the other day, when she was like that it was just a mess. She does the transports to bringing the patients to Kapiolani, the babies who are in trouble, and sometimes it's with COVID, right? So it is there. I don't know the numbers. I don't know how many there is. I know there are more than before, but I don't know how widespread it is among the kids. So I wouldn't want to say something wrong.
Yeah, no, I understand, and that's the ones I really worry about. Because we don't know the long-term effects of COVID on these babies and these kids, and I just I just wish our state would pay more attention to that, and at least show us or make the appearance that they're trying, and not just
yeah. I was like, when things started surging so bad again, and no, we're not even looking about doing distance learning. I was kind of shocked.
Yeah.
My son's school did it for the first week after break, but he's back in person now.
Yeah, one of our schools, Chiefis Kamakahele Middle School, just got notified that they're going to be out distance learning this coming week because they just have no staff. They have no staff.
Right. Yeah. So it's the cancel the flight type of mentality rather than let's prevent it, right? I don't know, and there's arguments on both sides too. It's not the same, right? Distance learning is not the same as being in the classroom, but I feel for I think that's a really big problem, and I don't know the right answers to it either. But how do you get kids to? You can't even get adults to take the right precautions. How are you going to get kids to do it?
Yeah, it's a tough dilemma, and I recognize that. But I'm sure in your line of work, there you run into dilemmas all the time, and you got to make the best decision for your patient. Likewise, I expect that from our government, and they have made some stances on the minimization of this, and that in fact the schools. How in the world can you say that cramming kids in a classroom or in a gymnasium or wherever, and allow them to be when possible 3 feet apart, and that's okay for our state, but yet it's not safe enough to open up your legislature or your councils to public meetings.
You like that? The legislature is still locked down, right? You can't go in there. You go down there, the doors are all locked. You can't get in there.
Exactly.
But the schools are open. There's a little bit of a hypocrisy there, isn't there?
Yeah, absolutely. And I don't know if they even recognize that. I don't know if they just think that people can believe us. I saw a photo of Waimea Canyon. Over there, the principal requires all the kids in the morning to go under the covered basketball court in the morning until the bell rings, and then they get to go to their class. I couldn't believe what I saw, and I cannot share the picture because obviously these are juveniles, but they're all shoulder to shoulder. They are crammed in there, and I'm thinking, how can you even think for a minute that that's safe? It's not. It's not safe. And then you wonder why these cases, and then the DOE guy can come out that the spread isn't coming from the schools, it's coming from outside the schools. Now, where's the science? You guys are not using, these guys aren't using data, they're not using science, they have an agenda, they have their plan, and they are going to move forward and make it fit, make what's happening or what they do, make it fit to their agenda, and they're doing it. And a lot of people are getting sick.
That's very true. It's very frustrating. It's similar to, it's like if you listen to the hospitals, not one healthcare worker got it at work. Every single one of them got it in the community. I've had them deny it on one of my friends. It was in the community, even though her family all tested negative, and then one by one, all her coworkers tested positive. So they finally did approve the work comp. I'm like,
I mean,
know,
hello.
but the first thing, it's not like, oh, well, let's look at it. It's like the first thing, no, community acquired.
Yeah, it's all
Yeah.
community
It's always
acquired.
somewhere else, right? So at school, you don't get it at school, you don't get it at work, it's somewhere else.
Yeah, it's kind of insane. I mean, I mean, you guys are in it every day, and to try to deny or even allege that you didn't get it at work. I mean, I think that should be the norm. That should be the automatic worker, and
Right.
you working full time in a
I,
COVID ward or in a hospital. Then they should
right.
the state
You're
should have
dealing
to
with the
prove.
public.
The burden of proof should be on the state that you didn't get it from work. You know what I'm saying?
Correct.
If you want to deny a work comp claim,
that is the theory that we go on. But how it goes, I'm not sure how any have panned out. It's like I advise every single one of our members who gets COVID to file a work comp, and to fight it if it gets denied. And how many do? I don't know. We don't have statistics on it because they don't tell us when they filed work comp. Usually, most people it's their privacy, right? We don't have a legal right to that information, but because there is the assumption, and that is a theory that would go on that you presume that the employer has to prove that you did not, that you got it somewhere else, right?
That's how it should be. I mean,
yeah, but I'm not sure how it would pan out. So you never know when you go for a hearing, right? The judge makes that decision.
Yeah, and those things take a long time.
Yes,
it takes a very, very long time, and it's not fair to the employee. It's just so unfair to the employee. But we'll see.
And workers' comp sucks, right? It's like you can't. It's what depends. It's a percentage based up to a certain amount, right? You don't make nurses are pretty high wage earners. You don't make anywhere near what you would make working on that. And getting healthcare, a lot of providers don't accept work comp. Mm-hmm. So it's not like, oh, you got the gravy train because you're getting work comp. No, it's a bare benefit.
All right, I'm going to ask you one more question before I let you go, and it's this theory that is spreading around the internet on social media that everyone should go out and go get COVID, go get the Omicron to build your immunity, because once you get it, you never get it again. And I've read some very harsh articles from medical experts that are saying don't do it. That's not right. But I know you're not a doctor, but you're in that industry. You're there. You talk to doctors all day long. You think that's a good idea to go out?
No, definitely not. I understand
Omicron.
No, I understand the urge. I understand the line of thinking that people just get over with, right? And then it's controlled but it's not necessarily controlled. And who said you can't get it again? So, some people, they want to say, oh, the natural immunity is better. Well, vaccines are natural immunity. You're building antibodies to the disease, right? So you can get it again. From the very first time it went through, there was cases. Remember when we were barely seeing anything, and they were reporting in Korea. I remember reading reports in Korea of people getting reinfected. This was a long time ago. So you can get it again, and especially as it mutates and you have different variants. Even more likely that you can get it again. And like I said, like you pointed out, I'm not a doctor. I'm not an infectious disease specialist. But I think you've had Dr. Dorkin on, right? That's his specialty. Yeah, he's a good guy and very, very intelligent. So I would defer to him on that question. And I can guess what his answer would be.
Yeah, I think I know what his answer would be. It's the same answer that all the other medical experts are. The Google doctors and the internet doctors, the ones that get their PhDs from Google and YouTube, they have a different, theory. But all the experts are saying, no, you don't want to get, Jesus Christ.
Oh, exactly. Yeah, so. You could end up, what are the odds? It's like, and where's it going to be? With spreading this much, it almost feels, and I get the feeling too. So I think that the general public, it almost feels like it's almost inevitable to get it. You see people getting it right and left, right? It's like, and there is that urge to just get it over with. Like, I understand the thought, but it's not a rational thought. It's not something that you should act on. To see. Remember the stories where they used to do back when we were kids? They'd have chicken pox parties.
Yeah. That was common. You get hey, we got to go to Auntie Grace's house. Why? Because the kids get chicken pox. The grandkids. Now we all gonna get chicken pox. But chicken pox didn't kill you, and it didn't give you long.
Well, it did kill a few people.
Oh yeah, I guess I shouldn't say that. I should not say
but,
that. Yeah.
And I remember, I was pretty little when I got it. It wasn't from going to a chicken pox party, but I was miserable. It was no fun.
Yeah, no, it's not. It's not. And COVID is worse.
Exactly. What can be more horrifying than not being able to breathe? Right. Fighting for breath.
Well,
that's
we've had a few. Yeah, like breathing through a straw.
Yeah,
trying to breathe through a straw. I've heard recently on our Clubhouse, we have a Clubhouse thing, and I'm hoping somebody will put up the link to Clubhouse. But it's basically a audio social media deal where it's like conference calls. It's a conference call, but it's on various topics that you pick. So COVID, we have a Hawaii COVID-19 Clubhouse that we hear from people all over the world, most of them from other states, but we hear from, and they describe what they go through, and they describe what they went through. That's what we need to hear. But if you promote that, then they say you're fear mongering. But I think that's the stories the state's sharing, not $50 gift cards, or you get to. No, you should be sharing the stories about what happens if you get this doggone disease. That is no fun. And the long haulers are suffering, and it's just not something you want to get.
That's exactly right. But it's, it makes it even more complicated because some people don't experience that. They get it and they do okay, right? And so you hear that, well, I know my cousin, he was fine. It's like, yeah, he got it and he lost his sense of smell and it was nothing, or it was just like a cold for him, So that's, you're just shooting the dice, right? Some people will be fine, some people won't. What we deal with in our profession right now is the overburden of the healthcare system. So that's what's happened. It's overburdening the healthcare system. Whether the disease itself is going to kill you or you're going to die because there are not enough healthcare workers to take care of you when you get in that car accident, you're dead just the same, right? It doesn't matter.
Yeah. Well, Doc, you make that. Daniel, thank you so much for joining us tonight. Any closing thoughts for our people? I know. I'm reading the comments and trying to catch up, and just know that the village here is sending a lot of love and aloha and mahalos to you and your entire group of people. But any closing thoughts?
Well, just my gratitude for the village, as you put it. We appreciate that, and there are small things that we can do, right? We need to all be responsible for ourselves, and we all need to don't go to that concert. Right? It's like, I get it, it's tough, but you use a little common sense. Wear a dang mask. It's not going to kill you to wear a mask, please. You can get vaccinated. Little thing, all these things are going to add up. And then we hope that, as far as in order to the long-term things, this is one thing that it's a little bit off topic, but I think it's very related, is the bill that we're trying to push through on banning mandatory overtime, because that's going to force the facilities to hire more nurses, because now they don't hire people because it's cheaper to make you work overtime than to hire a regular staff that they got to pay full time and get benefits for. So that's a legislation that really needs to go through, and we're going to be, hopefully you'll hear more about it as the bills get introduced, get through. So we can appreciate everybody's support on that. That would be wonderful.
Well, when all of that stuff gets introduced and you guys are ready, Daniel, we're always here for you, man. We'll bring you back on, and you can share. We got the village to write letters and make phone calls. That's what we're here for, and just know that you got a bunch of supporters watching. We love you guys. We feel helpless and knowing that nothing has changed. And just thank you for representing them and trying to do your best to make life bearable for these guys. And we'll keep the fight going.
Yeah, mahalo. Really appreciate it.
We'll keep the fight.
Yeah, it's like this forum, and it makes a difference. It does. We appreciate the support, and
thanks for
out, right?
That monologue, man. You saved it.
What was that?
Yeah, that's what we do. I said that's what we do. That's what we.
Yeah, you're cutting in and out. Your signal's weak.
You hear me? Oh, okay.
You're transforming a bit.
Alrighty. All right, guys. Hey, well, we appreciate you guys. We love you guys. Thank you. I'm not. We love you guys. We'll see
Aloha.
you. Take care. God bless.